My name is Laura Gawecki, and I'm here with fellow classmates and future occupational therapists Jillian Bell, Fiona Flynn, and Sophie Green. Our study is titled Strategies for Increased Upper Extremity Participation in Home Exercise Programs for Older Adult Stroke Patients. According to the Center for Disease Control and Prevention, every year, more than 795,000 people in the United States have a stroke. About 610,000 of these are first or new strokes. The aim of this study was to identify effective strategies for maximizing participation in home exercise programs, or HEP, for clients with upper extremity post-stroke impairments. The HEP non-adherence of individual post-stroke has been identified as less than optimal concerning participation and follow-through. An understanding of the effective strategies targeted for maximizing participation in HEPs can help occupational therapy practitioners select appropriate interventions to optimally fit clients' needs and wants.
The research strategy used for the collection of articles included online databases such as PubMed, HealthSource, CINAHL, and ABESCOhost. Keywords used during the investigation included stroke, post-stroke, occupational therapy interventions, CVA, home exercise program, cognitive strategies, upper extremities, motivation, and participation. The implications for clinical practice include providing therapy for older adults in an outpatient home exercise program to continue rehabilitation exercises taught by the therapist. Also, with the growing advancements of technology, clinical occupational therapists have expanded their interventions to include technology that could be used in all populations suffering from a stroke.
While completing the research to answer our group's research question, 3 themes were presented. This included reasons for non-adherence, technological motivations, and non-technological motivations. The reasons for non-adherence were found using questionnaires. The results showed these reasons to be doing different exercises than the ones prescribed, other without further information provided, afraid of falling while exercising, exercise is boring, exercise is painful, and 1/3 of participants did not report successful participation. It is important to note that there were more reasons provided for the participants' non-adherence to their home exercise program, but these findings were not significant. The technological and non-technological motivations were found through qualitative and quantitative studies. The technological motivations included game or other technological feedback when completing the home exercise program, the use of H-car robotic device in the participant's home environment, and the use of smart technology during the prescribed home exercise program, such as the use of a tablet. The non-technological motivations for increasing adherence in home exercise programs involved implementing strength training and music. These articles also showed positive results of including frequent medical professional follow-up and the application of co-op, the cognitive orientation to daily occupational performance, throughout the program. Our results showed that both technological and non-technological strategies showed significant outcomes. However, non-technological strategies showed more motivation, improvement in participation, performance, and quality of life.
Limitations. Some of the limitations that we came across were lack of occupational therapy-based journals reviewing this topic, and we were only able to use 8 articles to complete this project. Some of the limitations amongst the studies that we reviewed were small sample size, which makes generalization to larger population harder. There was lack of equal number of men and women in the studies. Most of the studies that we reviewed excluded individuals with severe stroke. Due to high comorbidity, recruitment of participants was difficult for the researchers. Also, there was lack of mandatory minimum recommended time to exercise given to the participants. And lastly, some of the older adults in the studies had difficulties using and navigating the technology. For future research, We would like to see data collection on specific recommended exercises provided by participants. We would like to see more occupational therapy-based journals, and we would like to see individuals with severe stroke included.